welcome to Inside Healthcare. A year ago, a Twin Cities woman underwent a life-changing surgery that opened a whole new world for her and gave her back her hearing, the first time in decades that she could hear clearly. We're very pleased to have with us Rian Nelson, the first Healthiest cochlear implant patient, and also joining us is her audiologist, Stephanie Lipke, Dr. Lipke. So we appreciate you both being with us. Thank you so much.
Thank you.
Rian, maybe you can take us back a year ago, almost to the day that we're taping this. What happened?
Yes, it was March 5th last year, and it was a blinding snowstorm that we were coming from the Eden Prairie, Bloomington border, which we didn't think we were ever going to make it because of the icy snow. But we were there, and it was just the most wonderful time to go through this. I'm so pleased that I did it.
You said you started losing your hearing 20s, 30s, something like that?
In my 30s. Mm-hmm.
And then what?
And I was wearing hearing aids. And then the summer of '93, I had a major Meniere's attack, which for about 4 months I did nothing but lay on the couch and whirl and twirl, as I refer to it. So they did 2 different surgeries that summer, and that destroyed the right ear, and consequently the left ear started to go.
You've told me that going into surgery last year, you were really nervous and scared.
I was nervous because I thought, after losing the hearing in the left ear, that if this didn't work, I would be totally deaf. And so it was a scary time, but I just put my faith in, and it came out wonderful. It was a miracle.
And after surgery, then you said that they don't turn it on right away.
No, for 6 weeks you're totally deaf. In my case,
wow.
Totally deaf. And so it made some very interesting conversations. I had a good friend that took me out twice for lunch with a pad and pencil, would show me, and then I'd answer. And but then when they turned it on, it was really, it was just awesome.
You know, we just take it for granted. Dr. Lipke, maybe you can tell us about the cochlear implant that Rian received, and how does it work, and who's a candidate for it?
Certainly. A cochlear implant is for somebody who has lost their hearing to the point where hearing aids can no longer help them. So even with very good hearing aids, Rian was still only understanding about 10% of what was said before her surgery.
Wow.
So she was really using lip reading and even sometimes pad and paper to communicate. So the cochlear implant is for somebody with severe to profound hearing loss with very poor word understanding. There's actually a lot of people out there who are fumbling and working really hard to hear with their hearing aids that could be doing better with an implant. And so there's many people that feel they're not doing well with their hearing aids that could be a candidate that don't know that they are.
So how do they go about finding out if they are a candidate and they should get one of these?
There is a testing procedure that we do for cochlear implantation, and it is done with hearing aids. And it's a series of different tests with words and sentences to test the word recognition for an individual. A cochlear implant is a different type of hearing. So our normal acoustic hearing goes from sound waves in the air to mechanical hearing to then electronic hearing as it moves through the hearing system.
Wow, so complicated.
It is,
Complex.
and a cochlear implant bypasses much of that, and specifically the outer hair cell areas of the cochlea that are damaged from hearing loss. In Rian's case, from her Meniere's disease, but some other people from progressive loss, from noise exposure, different environmental things, even hereditary hearing loss. So the implant bypasses that and stimulates the acoustic nerve more directly through electric stimulation, offering a different type of hearing than a hearing aid, but very routinely results in better word understanding. So post-operatively, even 2 weeks after we tested you, because you were doing so fabulous, and she popped right back up to 70%. So it was just amazing.
Wow. So what was it like when they turned it on and you can hear
well,
it for the first
I don't remember who said anything first, but I can remember everything was quiet. There was a lady there from the Cochlear company Dr. Stephanie was there, and another lady, another audiologist, and she had programmed it, and then she said, okay, it's on, and nobody said anything. So I finally said, well, somebody say something, and I don't remember who did, but I said, it's a miracle, I can hear, and you don't sound like Donald Duck.
Why Donald Duck? Is that
So because it's a
some people-
different type of hearing, the energy, the sound energy is different. So many people say that they have a different type of a sound quality. Donald Duck, I had one patient who said aliens, and that's different, and it's just based on each individual and how their body and their brain interprets the sound from the implant. So luckily, in her case, it was beautiful. And actually, I have to tell a story from when we turned it on. I often try to wait for the family member that's with us to talk first, just so that it's a memorable moment. And so we turned it on, and I kind of paused, and I was looking at her husband, who was also in the room, and they're kind of jokesters. So he may have even made a little joke and mouthed something without voicing.
Oh no, that's a bad joke. That's not a good joke to play.
But no, she's done fabulous ever since.
Well, it's just, it is a miracle for me, because from not being to understand people, what they were telling me over the years, it was just like all of a sudden, and even Dr. Service, who had said, that this may sound like Donald Duck, and when it didn't, I just said, oh, thank God, this is perfect. This is absolutely perfect.
So how has your life changed in this past year then?
Well, it's much better. I have this remote that I can take into restaurants now, and I can focus on the person that's talking to me. I can also make
So
it
kind of
louder or
directional.
softer, and that's a wonderful tool.
And didn't you tell me too that sometimes you do just turn it off?
I
Have
do.
complete
I do.
silence?
A lot of times Sunday morning, my husband watches TV and reads the paper at the same time, and I just don't put it on. I don't even put it on until after I've read the paper. I just like the quietness. But otherwise, jokingly, I can say that I can turn him off anytime I want.
And now you can hear all your children, your grandchildren.
Yes,
and-
yes, it's wonderful. It's wonderful.
Wonderful. So final advice for viewers on if they think this might be an option for them?
I think it's important not ever to settle with your own quality of life and your hearing. So if you feel like you're not doing well, go to your audiologist or seek a second opinion to see if there's something else that might be a better fit for you.
And where can they get more information?
You can always contact us. We are on the Healthy's website for Healthy's Audiology and ENT, or at our phone number, which is 651-232-0707.
And final advice, Rian, that you would give to someone out there who is having some hearing impaired, and what would you say to them?
I would say that you should go and speak to someone who is really involved with the implant surgery, and that not to be afraid. The surgery was very short. I would say 45 minutes to
Wow.
an hour.
A couple hours.
Was it?
Well, for the whole thing, once you get prepped and things, but the actual surgery.
Right.
Yep.
Right. And what I would like to stress is there was absolutely not 1 minute of pain. There was no pain involved. I never took pain pills. So don't be afraid of going. It's a wonderful tool, and it makes your life much better. Much better.
Wow. And Dr. Lipke, final advice also for our viewers?
Like I said, just seek answers, ask questions, and make sure that you're getting the care that you so deserve.
All right. Well, thank you for coming back and joining us again. And thank you, Rian. It's really been a pleasure to have you with us.
Thank
really
you for
appreciate that
asking.
sharing your stories. So thank you.
Thank you.